Ladies and gentlemen, welcome to the first episode of the Therapy Tea Time Talk by Physileap. We have a very honored guest coming on the show today for our first episode. He is a doctor from Hong Kong. His name is Dr. Roy Chan. Welcome to our show, Dr. Roy Chan.
Hello, Richie. Thank you for inviting me as a guest.
Thank you very much for coming up onto the show. It's an honor to have you.
Yes.
All right, so what we're going to look today is to just get a little bit more understanding about what you do and how long you've been in the field for and what you specialize in doing so that other people can know more about your field.
Okay.
All right, so I'm just going to be starting by asking some questions here. So the first question that I want to ask you over here is, we know you have been a doctor for a long time. Just wondering how long you have been a doctor for.
I'm a medical doctor in Hong Kong, and my specialty is family medicine. So I am a registered family medicine specialist in Hong Kong, that is a GP. And I have been a doctor for nearly 20 years.
Oh, that's a very, very long time. And in terms of, so you mentioned that you were a GP before, and does that mean that you have transitioned now into doing more specialized field within the medicine?
Yes. Initially, I was a GP, so I see all types of patients, like people suffering from flu, common cold, gastroenteritis, or also people with some chronic illness like hypertension. But all along, my interest is in sports, orthopedics, or exercise. So some years ago, I've changed my role to become a physician, mainly seeing people suffering from pain instead of being a GP.
And in terms of your practice then, so does that mean before, were you working in a private practice before, or were you working at a hospital? What type of setting were you based in the past, and how did it transition over time?
Because I was a family medicine trainee initially, so I have worked in various medical departments in hospital, like medical, surgical, pediatrics, all the specialties. And I've worked in hospital for around 4 years. And after 4 years hospital training, and I started to work in a few public clinic run by Hong Kong government. But I was still a GP, so I see a lot of people with all kinds of illness. And I have working in a public clinic for around 10 years, still in a public setting. But then I changed my job. I left the public setting and I went to a private clinic specialized in musculoskeletal medicine. And since then, I became a MSK physician.
In terms of your work as an MSK physician, can you tell us a little more about what you guys do at your end?
Basically, the people, the things that I do is very, very different. How to say? Maybe I step by step tell you just the story. Okay.
That would be lovely.
Because all along I love orthopedics and sports medicine, so I read a lot of journals or articles related to those specialty in my spare time. And I also see a lot of patients suffering from pain when I was a GP. But I by many of them, I don't know what is happening, because there's complaint of pain over here and there, but the physical examination was totally normal. So I don't know how to treat them. So what I did in the past is I usually give them some painkiller and refer them to physiotherapists if the pain is severe. But if the pain is just mild, I will just give them painkiller. So this is what we do in the past. A few years later, when I've joined a symposium organized by the Hong Kong Institute of Musculoskeletal FHKAM. It was truly an eye-opener. So I learned some new things. For example, at that time, I first heard of about trigger point, okay? Trigger point just some tight muscle that may cause referral pain, okay? At that time, I immediately thought of many patients that I've seen in the past. Why they have suffering from some unexplained pain? Probably they are suffering from trigger point. Then I started to think of, probably it is something missing in the traditional medicine. So since then, I start to became more interested in this field, in the musculoskeletal medicine. And later, around 10 years ago, after I attained the fellowship of family medicine, I started to put all my time, put all my effort in the MSK field. And I studied a diploma of MSK medicine run by the University of Otago in New Zealand. And I also joined the FHKAM to study from my senior. And at that time, I was still working in a public clinic. And by the help of my senior, I was able to have a MSK session. So I can use that session to see patients only with pain. And probably this is the start of my MSK career. And after learning MSK technique for a few years more, and I think because of my knowledge and skill is getting better, while I started to feel that I could have a lot of things to offer to my patient, but because of the limited time, or maybe because of the limited setting in a public clinic, so sometimes I feel unhappy and feel frustrated. So some years later, I left the public clinic, and that's why I started to work in the private clinic, and I work there till now. Probably this is why I changed to become an MSK physician.
So in terms of the sessions then, because you mentioned about time as one of the elements, so how long roughly is each session that you have with the patient now at a private practice?
Roughly, the official time is around 15 minutes. In fact, it is still a very limited time, very, very short time. But in case if my session is not fully booked, usually I can spend around 30 minutes for each of my patient. So of course, I can't do anything in my first session, but I will try to make a professional diagnosis in my first session, and also try to rule out any important problem like reflex and any other important problems first in my first session.
Oh, excellent. And in terms of in that case, so you mentioned the first time you see them, you'll be doing the initial professional diagnosis. And so does that mean that the upcoming sessions, if the patient come back, you'll be doing more focused on the specific treatments in that area, or?
Yes. Yes. Usually for the first session, because I'm still a doctor, so I still follow the traditional way of managing a patient. For example, for the first session, I need to rule out. I need to ask for any red flags. Okay. For example, is the patient suffering from cancer, any severe infection, or any trauma? If in those cases, probably I need to refer out or maybe refer for imaging. And secondly, I need to see if the patient needs referral for surgery. Does it need surgery? Because my profession is not surgery. As an MSK physician, we try to use non-surgical method to treat our patient. Okay. But for most of the patients that I see, usually those patients don't fit into these two categories. Okay. So can be managed by me. So I try to make a diagnosis. Okay. Think about pain relief, and hopefully I can find the underlying cause of their problem. But usually I don't have enough time. So if in the second section, usually the patients will feel better. So I will try to dig more into the underlying cause. So usually I will try to look for the biomechanics of the problem, the patient.
So in terms of your treatment and diagnosis though, because you mentioned about addressing faulty biomechanics. So in that case, are there any other diagnosis types of things that you do as well, such as ultrasound, for example, or?
Ultrasound is a very important part of my physical examination. It is just like the second part of my exam. But I would try to get the diagnosis by history first, taking history. For most of the time, I can get the diagnosis by history. And the next part, that is the physical examination, is to confirm the diagnosis made by history, palpation. We do a very detailed palpation because the purpose of my palpation is try to reproduce patient's pain. For example, if I palpate on the patient's supraspinatus tendon, even if it is tender, and especially if the pain is very similar to the patient's pain, then I will know, probably this patient is suffering from supraspinatus problem. And the second part of my management is we will look at the biomechanics, why he has supraspinatus problem. But as you have mentioned, yes, ultrasound is very important to me. Somehow, if I'm not very sure, then ultrasound scanning will be very important. It will help me to make the diagnosis because I can actually see the tear. If in case I suspect the patient get a tendon problem. And I think ultrasound is also a good way to communicate with the patient. Why? Because the patient can actually see the tendon tear, can actually see the pain. Because when my probe is just put on the shoulder, they can actually see the tear. Then when they see the tear, the probe also reproduce the pain, then I can very confidently tell the patient, this is because of the tear that produce your pain. So patient will understand the pain more and also will be more compliant to the subsequent treatment. So I think very important.
Thank you. That was a very comprehensive breakdown of what you do at your end in terms of that area. So let's say, for example, if the patients do come in and then you have to split up your session, or has there ever been a time when you have to split up your session, like in terms of the ratio of the session? For example, you do, partly the diagnosis again when you see the patient again the second time, and then a bigger portion of it is going to be a treatment. Did you ever have to do that in your appointments?
I think every section is similar. 1/3 is history, around 1/3 is the physical exam, and around 1/3 is explaining the diagnosis and management. Ultrasound scan, I don't always do. If I really need to do ultrasound scanning, probably I need to extend the time of the session because it takes quite a lot of time. And for the patient, even they come for follow-up, I will still take history because sometimes the patient's condition may change. So I still need to take history, still do exam every time. So roughly 1/3, okay.
All right, so I understand the ratio there. And I was wondering also in that case, so sometimes do you, let's say after your session with your patient, do you also give them homework to do as well sometimes? Maybe some corrective exercise at home or?
Yes, I always give my patient homework. I would say that it is very important. Why? In general, that the musculoskeletal problem can be break down into hardware problem or software problem, right? For software issue like some neuromotor control problem or some muscle imbalance problem, of course they need exercise just to release the tight muscle or to strengthen the weak muscle, right? But even the patients are suffering from hardware issue, like maybe they get some tendon tear, muscle tear, etc. What we like to do, we usually do some injection for them. That is biliary plasma injection, PRP or protherapy. But even they receive PRP or protherapy, they still I will prescribe them exercise because exercise can facilitate the tissue healing. So I always try to teach my patient to do exercise.
Okay, excellent. Thank you for that. And I was also wondering, though, on top of that, in terms of people that are new to the field of medicine, or people that are looking to get into your field, are there any specific or non-specific type of advices you're able to give to this population?
You mean the advice to new doctor or medical students?
Yes, or people, or medical students that might be interested in your field.
My advice is that as a student, of course, you need to learn all the book stuff, learn all the material in the curriculum. But I also want every student to understand that in real world, it is quite different. Every day you will see a lot of patients that you don't know and probably very different from what the book told you. So I think we need to keep learning, always learning. Every time we see a lot of patients, but if you don't know, try to read some books at the night. And my second advice is be open-minded, okay? Willing to accept new ideas or different opinion. Why? Just take MSK medicine as an example. Why there are so many other professionals in the world, like osteo, chiro, massage therapists, so many, bone setter, etc. My opinion is just simply means that because not all the pain problems can be treated by mainstream medicine. Not all the problem can be treated by surgery. So that's why people will seek help from other professionals. So my advice is even their theory or even their teaching is different from yours, but it doesn't mean they are wrong, okay? Please don't look down on them. And you may argue that they are not evidence-based enough. But my opinion is if you want something to be evidence-based, it may take many years. And it also depends on how many people will do the research or whether the research is of good quality. So if they are not evidence-based, it doesn't mean they are wrong. So I hopefully I want our new doctor or medical student to be open-minded. And my last advice is I think most important is that being a doctor is your attitude or your manner or your behavior. Try to be considerate, try to be a caring doctor, and always because you are treating a human being, not a disease, or even not treating a physical sign, okay? So especially we need to look at the patient's psychosocial aspect, very important. This is a very important thing that always mentioned in the family medicine. So if you want to make money, just make money, I think probably being a doctor is not suitable for you. This is my advice, okay?
Yeah, thank you for giving your advice in this area. And I think it is very important, even in the field of different areas, to pay more attention to delivering patient-centered healthcare, right, for the patients, which is very crucial. And prior to us ending, is there anything you wanted to add before we finish?
I think no. Thank you, Richie, for inviting me.
Yeah, it's a great pleasure and an honor to have you on the show today. Hopefully, people can learn a lot from you at the same time, and also looking forward to learn from you in the future too. So, all right, thank you again for coming up to the Therapy Tea Time Talk Show from Physileap, and thank you, Dr. Roy Chen, again for coming up. And have a lovely day. See you.
See you. Bye.